the nice figure that Pillar 1 has generated, I would like to discuss briefly how well are these in a scientific term, how old are these, how mature are they? And I think, in my perception, I might be wrong, I'd like to learn differently, but the idea about product and production research, you're pretty well off there. I mean, you're doing wonderful work. And with this project, you're also getting closer to understanding consumers. I think you need to get way closer to consumers and actually involve consumers in doing innovative work. But the situation, you just realized in this project that situation is important. I don't see any research from what I'm aware of where you're actually changing the situations. And that's actually key to making changes here. I think maybe an guesstimate could be that you're using 80% of your research money to improve product and production, and you're maybe using 20% on the person, but you're not using any on changing the situations. And changing the situations could easily be key to change people's behavior. And so what I'm going to present to you now is one case that you already heard something about, which actually changes and do innovation and make changes in the situation. And that is what the Charlotte from the UK presented earlier today, the Workplace Fruit Program. But before that, I just need to briefly say that situation, in my perception, is a combination or is based on what are the norms and the habits, and that we need social innovation to be able to change. And that's not the field of my expertise. My expertise is much more in how do we change the environment to be able to make availability of the good stuff higher and lower for the bad stuff. So this is what I'm going to present in the thing here. You can't do it alone. That's nice to put the poster again, don't you think? Yeah. To understand that you need other people to come along. This report that Anya also mentioned this morning is an amazing report, and I'm very fond of what they did here. They actually say that to be able to make an impact, you need a huge bunch of people or sectors to work together. This is what this thing here actually shows you. So from having a consumer perspective, we need to move, look at this, well, to include all the other sectors when you want to make a difference. So to make new situations, you actually need to consider the vast, open up your perspective from just focusing on the consumer to open up and look at the entire society, the players that actually can make a difference here in the situations. Here's another way that this report consider this. They talk about, of course, the personal dimension. You need to be able to be motivated. You need to be motivated to eat more, and it needs to be with your personal likings and so on. But honestly, again, we need to widen out the perspective and understand that the physical environment and the economic environment and the social dimensions are equally, maybe in some cases, more important when you want to change behavior. So we now have some agents that can do wondrous work here. I listed them downwards, and horizontally I listed those four dimensions that they did. I'll just give you three examples here. If we talk about the economic environment, what could be changed there? Governments could decide to take off the VAT or the taxes on some of the fruit and vegetables. And another example could be how industry can improve products and make them more available. And the third one I just want to mention are the schools. They can actually change the social norms towards eating more fruits and vegetables. And now to the not yet, just in a minute. This is how fantastic the report is. It actually goes from, maybe this one has the, yes. Up here you can see it talks about the plant something, I can't even see it from here. The plant foods. And they go into detailed references into their report about how, with respect to these different factors, can multinational bodies and the civil societies like NGOs and governments and industry, and they have the media and schools and workplaces, and they have health professionals and other professionals and people themselves. What can they do? They did a very detailed analysis of who ought to do what to increase fruit and vegetables intake. And that's amazing work they did here. So if you're from industry, go there and see what they thought was the obvious thing for doing when you are from industry or government or research. Yeah. So here we are. This is what I thought was coming for a long time now. This is the fruit and vegetable program in workplaces. So we are looking at workplaces, we are looking at what industry can do, and we're looking at the role of government, of NGOs. This program has already been introduced, so I just want to say that this is the wonderful idea about getting your employer to buy and give you for free the fruit in the workplace. It can be not only during lunch. Actually, we don't define workplace fruit as something connected to lunch. It needs to be at other times. We did a small study back in 2002, and I just wanted to show you that the fruit intake rose by 0.7 servings overnight. What kind of interventions can you think of that actually changes behavior overnight? This one does. And again, we heard that it reduces 50% of the goodies, the cakes and chocolate and licorice and whatnot, when we introduced this program in men. Take it further here. Now I want to brag a little bit about how implemented this workplace fruit program is in Denmark. And the National Board of Health produced these two reports, and here are the results. You can see the blue bars there from 2005, and the 2007 bars are red. And you can see that the bigger the workplace is, the more employees they have, the higher the penetration of the workplace fruit program. But again, please consider, we worked for this for 11 years, and after 11 years, you can see that 2/3 of the big workplaces, they have free fruit available just to grab for the employees. That's what we're talking about here. And here's another way to look at it, whether it's the public or it's the private or the semi-public places. So researchers in semi-public workplaces, they have the highest risk or chance or whatever for getting workplace fruit. And these figures have actually increased since then. So what is important is to understand how can such a normative change in society be generated. And to understand that, you need to be able to understand the partnerships of the 4 ideal partners involved in this. So let's start with the employees. Would they like free fruit when they work? Yeah. What the heck? If somebody wants to pay, why not take it, right? And it tastes good. And how about the industry people? Those who can make money from transporting and selling and marketing the workplace fruit to the workplaces and make money on that? Do they want to make money? Yes, of course they do. So kind of, we're all done here and we're done here. So the challenge for us as health people is to convince this group that they need to take on the responsibility and pay the bill here, right? So let me go through. So this is what we're doing. We already talked about the employers, the employees. They love this, and here are some of the statements that we registered. And this is not very intricate or complicated science. Just asking people, and we get results. And this kind of results can easily be used when you need after to promote this program. And one of the wonderful things is that when people love this in the beginning, they started bragging about it. And if you know something about communication, if you can get myths and you can get people bragging about something, they do your communication or your marketing very well for you. And the industry, we already talked about that. They want to make money, and we have new businesses popping up, and now they are in the process of merging to be bigger and better. And the 6 of 8, our role has been to legitimize the cost for the employer by doing evaluations and listening to the employees and finding out how happy they are. So we used the PR work deliberately, trying to create a pressure on both employers and employees to start asking for it or to providing it. So I think this is probably the most successful intervention we ever did, and today we don't even have a role in it. It's rolling by itself. So the employers, why the heck should they pay? Again, we're coming back to the idea about being able to do your work in analyzing what's in it for them. And compared to sick leave, the cost of providing a piece of fruit for every employee for a whole year is comparable to 1 day's extra sick leave. I didn't say there was a connection. Please note. But employers, they hear that, so that's fine.